How do we floss? First of all, you want to get a sufficiently long piece of floss, probably about 30 centimeters is enough. So once you have your approximately 30 centimeter long piece of floss, you want to secure it around your 2 pointer fingers. So everybody's going to find the best way for them to hold it. The way that I find easiest is to just wrap it around one finger a couple of times and hold it in the other finger, okay, like this. And I'm holding the rest of the strings with my other fingers, okay? The reason you want it on the tips of your pointer fingers is because this gives you the most control, all right? If you were to hold the floss like this, it's very hard to put it exactly where it needs to go, and it's almost impossible to get it right to the back. So the shorter the distance between these 2 pointer fingers, the more control you have. And if you've just got it on the tips of the fingers, you can get the floss right to the back of your mouth. So the action that you want to do is very deliberate. When you floss, you do one tooth and you go up and down, and you're really curving the floss around the tooth like this. Okay, so you go up and down and push against that tooth, and then you come across and then you go onto the tooth on the other side. So if you're pushing on that tooth, then you're pulling on the other tooth, and you go up and down, up and down. You only need to go up and down a couple of times. Going forwards and backwards doesn't really do much to cleaning the plaque off. These are the, so this is the surface between my 2 front teeth. This is the side that we want to clean, okay? So going up and down is going to be good. If we go backwards and forwards, see, we're not really cleaning much of that surface at all. So we want to go up and down. And we also really want to push the floss against the tooth, okay? So I'm holding it between my 2 pointer fingers, between my front teeth, and pushing against this tooth on my left, okay? Pushing up, down, okay? And as you can see, I'm going right under the gum. All right, up, down. And now I'm doing the other tooth. So I'm pulling against the other tooth, up, down. That's it, okay? So that action you can do for all of your teeth. Pushing, okay? Up, down, pulling, up, down. Okay, so as we were talking about in part 1, the teeth have this real curve. So if we're really doing a solid push, the floss is actually covering that curve on the front and the inside of the tooth. So if your toothbrush misses it a little bit, then the floss can get to it. So I'm going to floss all my teeth. It's not something that needs to take a long time, so you can see how quick it really can be. Okay, so that's all my teeth flossed. Now, if you are someone who is just new to flossing, the best way to do it is in front of a mirror so you can see exactly what you're doing. It is definitely a skill that you will improve with time, and it's important that you give yourself time to learn how to do it, or you're not in a rush, or if you're feeling frustrated, just kind of give it a rest, come back to it another day. Leave the floss with your toothbrush so that you see it and you're reminded to floss. Some people like to chill out in the shower and floss in the shower. There's no rules against when or where you can floss. Some of my patients like to do it while they're watching TV. You do whatever suits you and is okay with your family. But certainly if you have tried flossing and it's just not for you because you can't get your fingers in there, or you just can't get the movements down, then that's totally fine. You can try something like this. This is called a flossette. So the floss across here is held in by this little fork, okay? So I'll show you how to use the flossette. It's very similar in action. What you do is you push it up between the teeth, and if you have, generally the floss on flossettes is a little bit thicker than string floss. So if you can't push it up between the teeth, you can gently press on the little bow here, like that. Okay, same thing. So I'm gonna push against my tooth on the left and go up and down a couple of times. Okay, and then I'm gonna pull on my other tooth and go up and down a few times as well. And that's it, easy as that. So it's exactly the same for the back teeth. Pushing up and down, pulling up and down. And the side ones, you can also really do an exaggerated twist so that you're getting right to those front curves and the curves on the inside. Just like that, okay?